Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to officially welcome you to episode 328 of the Ask Dr. Angela podcast. It is snowing out here on the East Coast. You all know that I am Jersey-based, and we're like in the middle of a snowstorm. This is my second day not seeing patients or being in the office. And while it is nice to have a snow day, I'm someone that's used to being busy and doing things. That might explain why I'm recording a podcast in my home studio on this day, just to kind of keep busy. There is so much snow here. I literally, within the past 24 hours, my neighbors were gracious enough to blow with their plow my driveway and walkways. And then a few hours later, I had to go back out there and shovel it out. And then later on yesterday evening, I had to go back out and reshovel my drive and walkways. Being essential personnel, I have to have ready access to go to work. So, I've got to be able to get out. So I'm, in lieu of a workout, I've been shoveling snow, and that's been a heck of a workout. So how are y'all doing in the midst of this pandemic? Yep, I'm talking COVID-19, y'all. It's been crazy. I mean, who'd have thunk a year ago that this is where we would be? I don't know about you all, but I am just beyond anxious to get back to some semblance of normalcy. I have not been on a vacation in I don't know when. My travel plans have all been upended. I was supposed to go to St. Thomas for Christmas this year, needless to say. Or I guess we should say last year, since it's now 2021. Needless to say, that didn't happen. I haven't seen my parents in well over a year because of the vaccine. And I feel you. I feel all the frustration, the anxiety, but, onward and forward. So let's talk about this COVID. Symptoms. Symptoms that we commonly see with COVID-19 include, but certainly are not limited to, things like fever, cough, fatigue, muscle aches, headache, chest pain, runny nose, sore throat. Some people may or may not lose smell or taste. Early on, that just depends. And, typically symptoms appear from 2 to 14 days after exposure. How significantly you're going to be affected varies from person to person. I've seen people be completely asymptomatic, while others develop significant shortness of breath, which in turn could develop into a pneumonia and require hospitalization and even intubation. Those that are considered to be in high-risk groups are going to be at an increased risk of morbidity and mortality. Medical conditions that qualify as high risk include, but are not limited to, things like pregnancy, heart disease, obesity, smoking, diabetes, or any illness that compromises the immune system. COVID-19 is a respiratory-borne illness, i.e., it is spread through respiratory droplets that are released into the air when someone laughs, coughs, sneezes, breathes, or sings. Hence, the importance of wearing masks to prevent transmission. Virus particles can also land on inanimate objects and be spread that way, specifically if you touch an infected surface and subsequently touch your mouth, nose, eyes, etc. So how do we prevent spreading the virus? Prevention seems so simple, yet so difficult. They're like some of the obvious things. Washing your hands with soap and water goes a long way toward preventing the spread of the virus. Wearing a mask, that not only protects you from getting the virus, but it also protects you from spreading the virus. Other ways to prevent spread include social distancing, keeping 6 feet between yourself and others, avoiding crowded places or poorly ventilated spaces, covering your mouth and nose when you're coughing or sneezing. Either use a tissue or the inside of your elbow. Clean and disinfect frequently touched surfaces. If ever there was a time to be OCD, this is it. Make sure that you clean things like light switches, doorknobs, table and countertops, phones, faucets, anything that has high usage. And then just, be mindful of your own health. If you aren't feeling well, do not go to work. Do not go to school. So the vaccine for COVID-19. Right now, there's the Moderna, there's the Pfizer, and Johnson & Johnson is on the cusp of releasing their one-dose vaccine. By the time this podcast posts, maybe it will have already been released. But I get a lot of really interesting questions and very common questions about, is the vaccine safe during pregnancy? Will it affect my fertility? Can I breastfeed and get any of these vaccines? Should I get the vaccine? And of course, I am someone that believes that actions speak louder than words. And so my usual response to this is starting by letting you know that I got the vaccine. I did receive both doses of the Pfizer vaccine. I received my first dose on December 22nd, 2020, and I received my second dose on January 13th, 2021. And that was approximately 3 weeks after the first dose. Other than a little bit of arm tenderness, I did not experience any significant side effects. Even after the second vaccination, not much of anything. I got the vaccine without any reservation or hesitation. I got the vaccine for a couple of different reasons. Number one, I believe in science. I want to be safe not only for myself and family, but also for my colleagues and the women that I take care of on a daily basis. I have not seen my parents, siblings, and dear friends in well over a year. And certainly I do feel that getting the vaccine will bring me one step closer to getting to see them a lot sooner than later. Another reason I got this vaccine is to make a statement to my community, the African American community, which has disproportionately been on the short end when it comes to receiving comparable health care in comparison to other communities. Not just the African American community, but any community that involves people of color. Those communities just are not receiving the same distribution of the vaccines, and certainly their care in response to getting COVID is just, it's not the same as the care that's received in non-brown or Black communities. We'll just put it that way. And certainly the discrepancy in healthcare across the board in non-white communities is a disgrace. Certainly, me getting the vaccine is a way for me to ensure that people in my community and in those communities, i.e. Black and brown communities, will know that the vaccine is safe, that it's not an experiment that's meant to harm us. And while that may sound silly, there is a history of mistrust between communities of color and medicine, going as far back as things like the Tuskegee experiment. If you're not familiar with that, that might be something for you to look into. Important things to know about the vaccines, both the Pfizer and the Moderna vaccine. The Pfizer vaccine can be given to individuals that are age 16 and older. It's a 2-dose regimen given 21 days apart. The Moderna vaccine can be given to individuals age 18 and older, and similarly, it's a 2-dose regimen that's given 28 days apart. The technology utilized to develop these vaccines is cutting edge. They utilize an mRNA vector encapsulated in lipid or fat, which is then delivered into the host cells. Important things to know about these vaccines. Number one, they do not alter DNA or cause any genetic changes. These vaccines use the body's cells to generate COVID spike proteins, which in turn stimulate an immune response to develop antibodies against COVID-19. Another thing to be mindful of, these are not live viruses. So in talking about vaccines and their effect on pregnant women, lactating moms, and fertility, ACOG does not recommend withholding the vaccines from women solely because of pregnancy, specifically if they meet criteria for vaccination. You can get the vaccine during pregnancy. If you happen to work or live in an environment with an increased risk of exposure, serious consideration should be given, and is a conversation that you should have with your healthcare provider. Remember, whatever you decide to do is going to be the right decision for you. If you decide to get vaccinated, if you decide not to get vaccinated, your OBGYN provider will support you either way. If you do, however, decide to get the vaccine during pregnancy, it is recommended that you wait until you've completed the first trimester of pregnancy. This same rule does apply to lactating women as well. Moms that are breastfeeding should also be offered the vaccine in the same manner that non-breastfeeding women are, specifically if you meet the criteria for receipt of the vaccine. A very common question from breastfeeding moms is, will the vaccine enter into the breast milk? The answer to that is that it's highly unlikely because the virus is composed of nanoparticles that are injected into the muscle, and they tend to stay in the muscle and hence are not likely to enter the breast milk. And then the other common question that I get as an OBGYN is, does the vaccine affect fertility? The answer to that is a resounding no. So just make sure that, if you're on the fence, unsure, undecided, please have a conversation with your OBGYN, your midwife, your nurse practitioner, or whoever is providing your care so that you can determine whether or not getting the vaccine is going to be the right choice for you. I certainly hope that you all enjoyed today's podcast. COVID-19 is a really hot topic. It continues to be a hot topic because we continue to be in the midst of this pandemic that has killed, to date, almost 500,000 individuals. So in closing, I want to leave you with this. And again, this is from my She Went Out on a Limb, a book of inspiration for women by Sandy Gingras. Today's quote is, have faith. Have faith that we will get through this. Have faith in our ability to choose kindness. Have faith in our ability to do the right thing. And y'all know what I'm talking about. I'm referring to that recent insurrection on Capitol Hill and, all of these right-wing theories, white supremacists. It's just crazy. Please, please, please make sure that you check out my new and improved website, www.askdrangela.com. That's AskDrangela.com. There you can sign up for my YouTube channel. You can sign up for the blog post that comes out weekly. You can also sign up for the podcast. I did do a blog post on COVID-19, so please feel free to check that out and share it. Until next time, choose happiness. I cannot wait to reconnect on episode 329 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.